Aemcolo is a medication that contains the active substance Rifamycin. Rifamycin is an antibiotic that belongs to the Rifamycin class. Aemcolo is primarily used for the treatment of traveler's diarrhea caused by non-invasive strains of Escherichia coli in adults. How to use? The typical dosage of Aemcolo is 1 tablet, 194 mg, taken orally twice daily for 3 days. Aemcolo tablets should be taken with or without food. Swallow the tablets whole with a glass of water. It is important to complete the full course of treatment, even if symptoms improve before the end of the prescribed duration. Contraindications. Aemcolo is contraindicated in the following cases: hypersensitivity or allergy to Rifamycin or any of the components of the medication, invasive bacterial infections or diarrhea complicated by fever and/or blood in the stool, colitis or conditions associated with the significant alterations of the gastrointestinal flora. Special instructions. Aemcolo can be taken with or without food, but patients should stay hydrated. It is essential to drink plenty of fluids while being treated for diarrhea. Before initiating treatment, inform the healthcare provider about any existing medical conditions, ongoing medications, and allergies. If symptoms persist or worsen after completion of the Aemcolo course, future medical evaluation may be necessary. Side effects. Common side effects of Aemcolo may include headache, constipation, abdominal pain. It's important to report any severe or persistent side effects to the healthcare provider promptly. Aemcolo is intended for specific indications, and its use should be guided by a healthcare professional. Patients should adhere to the prescribed dosage and instructions for the most effective and safe treatment. If there are any concerns or questions about the medication, it's advisable to consult with a healthcare provider.